So this patient's coming in for removal of part of her toe. You can see here she has a massive ingrown that's here. She's had this on her other foot. She'd failed other basic procedures. So essentially what I normally do, she has this frozen now, so she has not a circumferential block, but essentially a modified digital block. So she's got freezing all through here. So normally I would just take out a wedge of the nail all the way down to the nail matrix and cauterize it, and about 75% of the time I'll never see those patients again. But if they fail that, or somebody else has done that and they fail it, then we have them back in and we'll do the same type of thing. We're going to take this wedge out, but now we're going to use an acid, a phenol, to actually kill the nail matrix. It's more effective at doing that. Now I would tell you, of the 10 to 15% that fail the first procedure, this secondary procedure with the acid is about 90% effective. So there's still a small group that'll come back, and in those cases we then talk about whether we take the nail out and ablate it, or whether you do a modified Van den Bosch procedure, which is where they'll freeze it, but now they take all of this dead skin out. And I've only done that 5 times, 6 times in my career. It's always effective. It's an excellent procedure. The problem is, because you're taking out so much skin, it's harder to recover from. And because people do so well with this as it is, I just don't do it a lot. But you'll see practitioners who say it's the best procedure out there, and they're not lying. It's extremely effective. So again, no pain when I do that at all?
No.
So here you definitely want to have very good anesthesia. So this is why people sometimes can't watch these videos, but the nail's very sensitive. So if she has sensation here, it's going to compromise the entire procedure. So I'm just going to pick a line that's sort of encompassing the area that's causing the problem and cut all the way down till I'm past the actual base of it in the nail matrix. And then I use this to undermine it. Now podiatrists will have some tools that are more specific to this, but you can use these. This is the key part here. You want to make sure that you're getting underneath the nail and loosening it from the underlying tissues, the undermining portion, because that's what makes the rest of this simple. If you don't undermine it well, when we go to take this out now, if you leave behind part of it, not that you can't get it out, but it becomes a lot harder. Now what I end up doing here with the pickups is I'm going to put back pressure on the skin, because I don't want to tear that out. I just want this to come out from its position where it's adhesed. What I want to do is little trauma to the tissues as possible, because that's what will cause her pain. So you can see where that piece came out. So this is why here, and this is why the Van den Bosch procedure is more uncomfortable. If I took this out, that's uncomfortable for the patient. If I leave this in, this will settle now because the actual nail digging into it is now gone. But if I took that out, she would be much more uncomfortable. Most cases like this is once that tissues, or that irritation to the tissue is taken out, she'll be able to sort of walk around. It might feel like a deep bruise, but it shouldn't give her too much trouble at all. So now that that's done, I essentially use the hyfricator to still cauterize a couple of areas just to minimize the bleeding potential. Mainly the corner of it, because that's where it'll all come from. This one's pretty good. You can see there's not a lot of backflow, there's not a lot of bleeding that's here at all. But essentially what I'm going to do is, because I'm using phenol, you don't always have to do this, but sometimes it's nice to do it. I'm going to just put some Vaseline around the base of the nail. The reason I do that is because the phenol won't affect the healthy tissues as much. So just put some on like that. And the other thing I tell residents, so this is obviously a ceramic mug. I made the mistake of using a styrofoam one when I was young in my career, and the acid just ate through it and fell onto my pants. That was lovely. So essentially I want to get this up into the nail matrix as much as possible. So essentially I'll just rotate that in, and then I'll even leave that there for a second. And that's the part we want to be affecting by this. So it's not so much the rest of the skin. So this, I'm just going to massage that down so it's covering the nail a bit. So this portion up through here, that's not the part that's critical to be treating it. The growing part of the nail is at the base, and that's where we want to just leave this in place for maybe 30 seconds at a time. I usually do, in medicine we do a lot of things in threes, so typically I do 3 or 4 times to make sure that the actual nail matrix has been affected by this. So if I was doing the entire nail, I would roll this across the whole matrix. And all the phenol is just a combination of acids. We should always be able to slip that just underneath the edge like that, and it can sort of stay there. There's nothing fancy about this, it's just about being patient with it more than anything else. So in terms of nerve endings here that's been affected when we did the freezing ahead of time, the tibial nerve branches into a dorsal and or a medial and a plantar, medial peroneal nerve, or medial plantar nerve, sorry, and a lateral plantar nerve, and then there's a deep peroneal nerve. Those are what we block here when we actually do the digital block. You're feeling fine?
Yeah.
So the other thing I have to tell patients when you're using the acid, unlike where I just hyfricate or cauterize the corner of it, the acid makes the underlying tissue bed weep for a while being usually a number of weeks. So the healing wound bed will be more moist, and you just have to make them aware of that, or else they'll wonder why it just keeps producing sort of a discharge with it. So we're almost done here. So I'm just going to do one more. So again here, the Vaseline's completely optional. I do find it's just kind of nice because it limits sort of the irritation. But if you're careful with it, you don't have to use it at all. I find if I'm showing you how to do this, it's a good idea to be using it. If you're more confident, you can control the phenol a little bit better. You can avoid most of the irritation to the secondary tissues, but this does help. All right. Just gonna clean that off. So we're just going to put a dressing on this now, and then it should be good to go.